There are some differences in the vaccines. So Moderna and Pfizer are not identical, but they are very similar. They both use mRNA as a way to elicit that immune response. They both require 2 doses, both very, very similar in terms of efficacy and safety, which both of them are just outstanding. Johnson & Johnson, which is really phenomenal, is going to be, for right now, a 1-dose vaccine. Again, really efficacious in preventing that severe COVID. Safety profile from what we're able to review so far from the data is just looking phenomenal. So we're really excited to have another tool in our belt. We do not recommend any type of prophylactic or pre-treatment with Tylenol or a non-steroidal like an ibuprofen before getting the vaccine, kind of like an anticipation that I may feel some side effects. And the reason for that is because it can potentially blunt that immune response. Now, with all that being said, if you do receive the vaccine and within 24 or 48 hours later, you start to feel some fevers or some body aches, and it's safe to take Tylenol or a non-steroidal, you can go ahead at that time and take it. We know there's a lot out there, particularly after the second dose of Moderna and Pfizer, that we kind of warn patients, if you will, that if you're experiencing fever or chills or body aches, that they're safe and that they're temporary. We use this term of they're reactogenic types of vaccines. We know that those effects are more common after the second dose, and we also know that they're more common in a younger population. But I think it's really important for everyone to understand also that if you don't develop those really not so fun feeling side effects, that doesn't mean that your immune system isn't responding. There's no correlation per se in the severity of those reactogenic effects and the amount of immune response that you're feeling. Herd immunity is the idea that enough people in a certain population are essentially immune to the virus, so that if there's someone in that community that does have the specific infection, it really doesn't have anywhere to go because those around are immune. So we're estimating that with SARS-CoV-2 that we'd like around a 70% immunity rate in that specific community to achieve what we call herd immunity. And again, that can be achieved through natural infection and vaccination immunity. And obviously that's our goal with getting that vaccine out.